Hello everyone, today we are going to study the maxilla. The maxilla is the most important bone of the facial skeleton. It forms the central part of the face, it gives shape to the face, and it contains half of the upper jaw. Actually, the two maxillae together form the upper jaw. And as you can see in this picture, the maxilla has got a body which is more or less pyramidal, a three-sided pyramid with its apex here at the zygomatic process, the base here on the inner or the nasal surface. You have an anterior or facial surface of the body with the nasal notch. You have a posterior surface of the body which actually forms part of the infratemporal and the pterygopalatine fossa. You have a superior surface or orbital surface of the body, and you have a base or a nasal surface of the body. So apex, zygomatic process, base, nasal surface, anterior facial surface, posterior infratemporal and pterygopalatine surface, superior orbital surface. And apart from this body, we have processes. The frontal process of the maxilla over here, the zygomatic process forming the apex of the pyramidal body, the alveolar process bearing the sockets for half of the permanent teeth of the upper jaw, and on the medial side over here you have a palatine process forming the hard palate, that is the roof of the oral cavity and the floor of the nasal cavity. And if we are now going to look and see how the maxilla fits in with the rest of the skull. In this picture you can see that the maxilla is forming part of the face, it is forming part of the superstructure of the nose, it is forming part of the nasal cavity, it is forming part of the floor of the orbit and the medial wall of the orbit. And you can see here is the alveolar process of the two maxillae together forming the alveolar arch bearing the teeth of the upper jaw. And if you look at this picture over here, you can see a side view of the maxilla, a lateral view. Again you can see the alveolar process here, the nasal notch over here, the rest of the body of the maxilla and its frontal process over here. If we look at this diagram, it is an enlarged diagram of the lateral view of the skull. Here you can see that the maxilla is over here, and here you can actually see two surfaces of the maxilla. You can see the body of the maxilla with its facial surface or the anterior surface over here, and you can see the posterior or infratemporal surface of the maxilla over here. And here is the frontal process of the maxilla, and here at the apex of the pyramidal body you can see the zygomatic process. And you can also make out that from this zygomatic process to the first molar you have a strong buttress of bone that is actually meant to transmit the powerful forces of mastication. In this picture what you can make out is posteriorly the maxilla is in contact with the pterygoid process of the sphenoid, and this gap below between the pterygoid process and the body of the maxilla is filled in by the pyramidal process of the palatine bone. And in this lateral view, after cutting open the zygomatic arch and removing this bar of bone, you can see this slit, the pterygomaxillary fissure between the maxilla and the pterygoid process. And here behind the body of the maxilla is a recess, another small chamber which is actually the pterygopalatine fossa. And again here is the nasal notch with the spike of bone here, the anterior nasal spine. And if we look at the base of the skull from below, we can see a different view of the maxilla. You can see the under surface of the body, and you can see over here the infratemporal surface or the posterior surface of the body of the maxilla here and here. Not only that, in this view you can make out the alveolar process of the two maxillae and the palatine process. Here you can see the shelves of the palatine processes of the maxilla. Together they are forming the hard palate along with the horizontal process of the palatine bones. So here you can make out that the maxilla does indeed form the major part of the hard palate, forming the roof of the mouth and the floor of the nose. That is all for this video. Thank you.